Despite the advancements in treatment, diagnosis, and supportive care in human immunodeficiency virus (HIV) infections, many acquired immune deficiency syndrome (AIDS) deaths are associated with malnutrition and its management. 1. Human immunodeficiency virus plays a significant role in the development of malnutrition through multifaceted ways. Firstly, low dietary intake, loss of appetite, mouth ulcers, and food insecurity cause weight loss, which leads to severe and moderate malnutrition. Secondly, because of the malabsorption of macronutrients and altered metabolism, infected individuals could be malnourished. 2. Undernutrition is common among HIV patients in the poorest regions, including Ethiopia. 3. Its prevalence among adult HIV-positive individuals in sub-Saharan Africa, SSA, reaches 23.72%. 4. There is a shred of evidence in Ethiopia regarding the burden of undernutrition in HIV/AIDS care among adult populations. It ranges from 16 to 29% in southern and central Ethiopia, 5, 6, 7, 8, 9, 22.2% in Cairo, 10, 23.6% in West Shewa Zone, 11, 42.9% in Tigray, 3, and 23.2% in Dembia District, 12. A systematic review and meta-analysis of evidence also showed that more than one-fourth, 27.4%, of HIV-infected adults receiving ART are undernourished, 14, with higher prevalence in the northern and central parts of the country, 13. Different causes and risk factors are contributing to the development of adult undernutrition in HIV/AIDS care. One of the main nutritional issues with HIV-positive patients is their low dietary diversity, 15-16, as the majority of those afflicted did not maintain a healthy diet, which could have an impact on their immune system, which HIV is already attacking, 17. Lack of ready-to-use therapeutic feeding, RUTF, advanced clinical stage, development of gastrointestinal symptoms like diarrhea, not taking cotrimoxazole preventive therapy, CAPTAIN, tuberculosis, TB, infection, food insecurity, poor ART adherence, low CD4 count, substance use, longer ART duration and low monthly income, 3, 6, 7, 11, 13, 18, 19. Undernutrition is twice as likely to occur when OIs and other comorbidities including anemia and eating disorders present. Furthermore, social support lowers the risk by 36%, 20. Among HIV-infected populations, the prevalence of food insecurity may also exceed 80%, which affects their nutritional status, medication adherence, and missing appointments, which all affect treatment outcomes, 21, 22, 23. The impact of depression, 24, high family size, 19, 25, and low economic status also play a significant role in the development of undernutrition in HIV/AIDS care and treatment. 8. The Ethiopian government recognized the impact of malnutrition on the outcome of HIV/AIDS treatment and developed guidelines stating that individuals with HIV should consume up to 20% more energy, 420 kilocalories, per day in addition to the national guidelines for comprehensive HIV treatment and care. This was an attempt to address the nutritional issues faced by HIV-positive individuals. 26. Undernutrition accelerates the progression of disease and the risk of AIDS-associated mortality. 27. A piece of evidence showed that a unit increment in weight reduces the rate of second-line ART, SLART, failure by 8%, 18, and low BMI is also associated with virological failure. 28. Undernutrition also increases the probability of lost to follow-up, LTFU. 29, which might affect the level of adherence and be associated with 60% of HIV/AIDS-related mortality in Ethiopia. 30. Improved nutritional problems and better quality of life are the results of nutritional interventions in HIV care. 31. Knowledge of essential components of nutrition and incorporating them in the management goes a long way in improving quality of life and better survival in HIV-infected patients. 1. For food-insecure people with chronic illnesses, comprehensive, medically appropriate food support may enhance several health outcomes. 32. Despite undernutrition being among the over-researched areas in HIV care in Ethiopia, the focus of previous research was on first-line regimens and children. 4, 13, 14, highlighting the need for further research in advanced HIV care. Long-term sustainability in assessing the nutritional well-being of HIV-positive patients is a key component of HIV care nutrition programs. 31. Therefore, this study aimed to assess the nutritional status of HIV/AIDS patients who are on SLART and its associated factors in northern Ethiopia.